Hello everyone out there, and welcome to this session. And I'm excited to talk to you about accelerants as it relates to private practice and physician burnout. I'm Halbert. I'm from Christiana Care Hospital in Delaware, and I want to thank the session chairs and our program chairs for allowing me the opportunity to tell you my story today. So I don't have anything to disclose, but I would like to disclose that this is a very personal talk for me. This is based on the last several years of my life and my experience with burnout. And so let's begin. So this was me. This was my first day in the OR out of fellowship, and you can probably see in my eyes the excitement. There was a slight fear in joining practice and taking care of patients without having that parachute of a fellowship director behind us. But overall, I was completely excited to start working. And I joined a very busy private practice group who I was very familiar with. And within a very short period of time, I was incredibly busy. I was doing anywhere between 8 to 12 cases a week. I was seeing somewhere between 35 to 40 patients in the office on a given day. Our contracts were kind of unusual. The one caveat in that contract was that our incentives were actually based on collections, not RVUs and not even billing. It had to do with the collections that were coming back, which didn't seem like a big thing to worry myself over in the very beginning. So let's talk about some of the risk factors I had. So first of all, I was a surgeon, and 30% of surgeons do experience burnout at some point in our lives. That's a not insignificant number. Younger surgeons tend to be at a higher risk, and certainly I was the newest of the new, so I was at risk. Women have a slightly higher trend towards burnout than men, but it isn't really statistically significantly different than our male counterparts. So work-life balance is very important to maintain, and I don't really think there's a true balance, but there is some kind of ratio that seems to work in everyone's lives. A lot of that is based on children, and I didn't have children actually, and even so, it seemed to work a little bit against me. I was put into late cases or worked later hours in order for my colleagues to go pick up their kids and do different activities with them. And often I was put on bigger holidays where they felt that because I didn't have children, I didn't celebrate as much. So I was doing Christmases and things like that every year. Marriage tends to be a very positive thing when it comes to protecting us from burnout. But that is only if the marriage is a solid one. And I found myself in a very troubled spot with my marriage around that time. And so it really enhanced the burnout that I was experiencing. Anyone with compensation that is not based on billing actually puts you at increased risk. And so, and if you can imagine somebody that has compensation based on incentives that even a portion of that billing now is out of your hands, we've even increased our risk a little bit higher. The amount of time that we work each week certainly will increase our risk for burnout. That includes the time that we spend as surgeons inside the OR and outside the OR. Surgeons are happiest in the OR, of course. And so if we're out of the OR a lot doing patient paperwork, other patient care versus being in the OR, it can negatively affect us. And the amount of nights that we're on call, certainly folks that are on every 2 to 3 nights that are busy nights especially can increase your risk. When we look at the surgeons that are at the highest risk based on some of these risk factors, general surgeons, trauma surgeons, urologists, otolaryngologists, and vascular surgeons are the most highly ranked. So why was I at risk? In addition to the things I've already mentioned, I was traveling to no less than 3 locations every day, to a surgery center, to different hospitals, to different office locations to care for patients. And because of that, it was very stressful to make sure that I was getting to my next location on time. I was late for patients. I was rushing through cases to make sure that I could get to the next location in time. It added a lot of stress to my life. There was no such thing as a lunch, which I thought was actually normal because I didn't have one during residency, so why would I need one as an attending? And multiple times I'd be in the middle of afternoon office hours and would be about to pass out. I was the low man on the totem pole in the practice that I joined, and so I became their workhorse. Any work that needed to be done, I was the first call for all of that, working late, despite the fact that I wasn't on call. I didn't even see a physician, primary care doctor, or otherwise for the 2 years that I was in this practice. I really didn't feel like I could even take a late afternoon off to go see the dentist. So it was really, I was the workhorse. And all that added up to a point where I felt that I wasn't safe for the patients. I was seeing so many patients in the office, and then I would see them the day of their surgery. And as a bariatric surgeon, I take a lot of pride in building a strong relationship with my patients. And I would go to their bed and not recognize them. And I would worry that their workup wasn't complete. And did I review everything as thorough as I should have? Did I miss something? Was there anticoagulation that I didn't stop? And it was really difficult for me, and I was scared for my patients and for me. And I experienced this emotional exhaustion from that constant fear. And my way of trying to push past it was to depersonalize myself from it. And I knew I was in a really bad position. So the first thing I did to battle out of it was to recognize it. I think that's the most important thing that you can do, is see that you are in a bad position as a surgeon, as a provider, as a human, and start to work towards a solution. And so I started to talk about it with friends, with colleagues. I was very careful in who I spoke to about it, and I started to create a path forward. I wrote my letter of resignation after having multiple discussions, and within a few months, I joined Christiana Care, where I am now, as a hospital employee bariatric surgeon. So I'm still in community practice, but not in private practice. And I love my job, and I love my patients, and I love what I do every day. And so I am very thankful of the path and the journey that I took beyond those feelings and beyond that burnout. And so why do private practice surgeons have that risk of burnout? There are some top accelerants we can certainly mention here. Like I mentioned before, there are a lot of challenges with that work-life balance. I don't think balance is really a real thing, but trying to balance owning a business and running a business and being part of that business versus the responsibilities at home is very difficult. And that's private practice and beyond, certainly. When you are working long hours, that work-life balance certainly gets thrown into flux. There tends to be some delayed gratification in surgery. That goes with and without private practice. And that delayed gratification in what we're doing is sometimes very hard and can certainly lead to burnout. There is an ever-changing environment with regards to reimbursement. So understanding MIPS and MAPs and bundle payments and understanding how we get paid as surgeons and how we can then turn around and pay our employees in private practice and keep the rent up on our office locations and keeping up with current standards at each of the hospitals that we work at, that all adds up to potential for burnout. We have a certain demand for clinical productivity in private practice. Again, that ties back into how we can maintain our office spaces and we can pay our staff to do the work that we need done. Oftentimes, because of that need for clinical productivity, we have very overcommitted schedules that are oftentimes inflexible. And I think one of the biggest things that you can do to somebody to promote burnout in them is to take away their ability to schedule and maintain their own schedule. Being able to leave an hour or two early from work to get to the dentist or the eye doctor to be able to volunteer to do something with the residents and teaching. Those type of things are so important to allow your employee or your colleague to have. Oftentimes in private practice, we have a lot of patients because we want to be clinically productive, but sometimes we're left with fewer resources than some other larger institutions. And so that can in and of itself be very stressful to the provider, and that stress, of course, leads to burnout. That also then builds right into patient care challenges. Getting patients to the right place at the right time at the right tools is really vitally important, and that also can lead to stress. So what are some of the consequences of surgeon burnout? I don't think this list is all inclusive, but I think it highlights some of the main points. The first few that I have listed here have to do with the surgeon themselves as a person, as a human. We see substance abuse, we see strained personal relationships. Certainly burnout can lead to depression and even suicide. The next set of consequences here has to do with patient care. A provider that is burned out may order more tests. They may ask for more consultations. They may be unable to really decide on who needs what, and so everyone gets it. This can also lead to an increased frequency of patient care mistakes. This certainly then increases the risk for malpractice. And lastly, it's how we impact those around us. We have decreased patient satisfaction scores coming back. A surgeon can become disruptive, throwing stuff, yelling at colleagues, yelling at teammates. And this certainly then is played out through decreased empathy for our patients that we are caring for every day. So in conclusion, the accelerants that I mentioned here, the risk factors for burnout, are not specific to private practice. But there are some key things that we see in more frequency in our private practice surgeons. And most importantly, we have to be able to recognize burnout and the risk factors associated with those burnouts. That's what we're doing here today. That's what this talk is about, recognizing those risk factors. It's those risk factors that we want to eliminate in ourselves and in our colleagues and our employees so that everyone can enjoy a long, healthy career taking care of the patients. Thank you very much for your time today. It was a pleasure to talk to all of you. I'm certain that if you have any questions, you'll be able to get a hold of me. And thank you, Sages, again for the opportunity to talk today.